Okay, we'll continue today with the equilibration of our case. We've mounted our case. We've made sure that the models are positioned back on the articulator as they were before. It's important. If you don't do it properly, you're going to be equilibrating the wrong bite at this stage. So it's very important that the models are mounted as they were before. And of course, we place some plaster on the sides of the cast with some notches that we did previously to ensure that the models do not move off the mounting during the equilibration process. Okay? We have our pin back to where we started, and as it stands right now, my pin is slightly open, so the incisal pin is not exactly touching the table. What we're going to need for this procedure, we're going to need some articulating paper. This articulating paper here, it says it's 80 microns. What does that mean? 100 microns is a tenth of a millimeter. So this is 8/10 of 1/10 of a millimeter. And you can certainly get articulating paper that's thinner than that. The other thing is, with the articulating paper itself, in between the paper, it comes in two different shapes. You can start off by tearing off this horseshoe shape, and if you flip it over, it's got different colors, so you can alternate between colors so you don't get mixed up between applications of the paper. But also, in between, we have these very fine separating sheets, which I like to use, and I'll show you a little bit later on how to use these. And this really gives you a good sense if everything is in contact. Okay, so we'll go back to that. The other thing you're going to need is maybe a pair of scissors so you can cut the paper, and also a handpiece and a very small burr, usually a number 8 round burr, something like that. Stainless steel is probably better than a carbide burr because a stainless steel is a little bit smoother. And I have something very similar to that here, which is almost like a paired burr. This is carbide, nevertheless, but it's a very fine finish. This is a little more coarse. So try to favor something that's a very fine finish to it. So what I'm going to do, I'm going to start by cutting my paper. And you don't need to use this particular shape. You can also use, that's the part that's on the back of it. So I'm going to start with this. And I find this to be a little bit too wide. So what I'm going to do, I'm going to cut it in half. If you start using this paper here, as you typically might see it elsewhere, and start tapping your articulator together, you're going to get a lot of imprint of the paper that doesn't really exist, or it's not true. So I like to use just a smaller piece of paper and do one tooth at a time as I'm tapping away across the arch. I think you'll get a more accurate imprint of where you need to reduce. One thing I failed to mention, you can also have some wax solvent or wax remover on a piece of gauze, just a little bit. There is a little bit there. So in between applications of the articulating paper, you can wipe some of the imprint off so you're not getting confused in between applications. Okay? So what I'm going to do is first visually assess where the case is coming together prematurely. And as it looks to me right now, it looks like somewhere around the 7s and the 6s. So I anticipate to have some kind of indication of the paper towards the first and second molars. Okay? So I'm going to start by just having my articulator on the bench, and as far as the centric latch is concerned here, you don't want to have it too tight. You want a little bit of motion to your articulator, so undo it and just lightly tighten it together so this goes up and down rather quickly. And as I'm doing this, I'm not going to tap it hard. I'm not going to force the articulator to come down. So I'm just going to let it sit on my bench and lift and let gravity apply the force. So it really doesn't matter which way you start in terms of the paper being blue side up or red side up, but just remain consistent as you're doing this. So I might start with the blue side up and then I'll flip over to the red side up after on the next application. So you might have a bit of an easier time if you just use your right hand or your dominant hand. And just to get a better view here. So I'll have the paper like so while the articulating is sitting on the bench, and I'll tap back and forth. And as we open the case, we have, as we suspected, we have premature contacts, primarily on the 7s and the 6s, nothing so much on the 5s and the 4s. And look on the opposing arch, we have, again, some here and some here. You'll get imprint on the cusp tips and the corresponding central fossas, marginal ridges, and incline planes, but you don't want to be reducing any of the centric holding cusp tips at this point, which are the lingual uppers and the buccal lowers. So I'm going to start by doing some selective grinding, equal amounts on the upper and lower teeth. So I'm reducing in the central fossa region as well on the mesial and distal marginal ridges. And I'm trying to create the same amount of reduction between upper and lower teeth. Just turn that down a bit. Depending on the quality of your handpiece and your burr, probably around 30,000 RPM should be sufficient. So now I'm going to wipe off just a very small amount of wax remover there. And I usually have another piece of gauze that doesn't have anything on it and wipe it dry. So now I'm going to bring my case together a little bit. Hopefully it's a little more together so I can see that the 4s and the 5s are trying to come together. The pin is still open, so we've got some ways to go. So now instead of having blue side up or red side up, you can alternate. It really doesn't matter. If you're cleaning the paper in between, it really doesn't matter. So I'm going to move just a little bit faster this time. Just a gentle tap. And I'm going all along the posteriors as I'm doing this. So as I'm tapping up and down, I'm moving my paper back and forth, although I anticipate the paper to leave some marks with the 7s and the 6s for now. And here we have some more indication of the paper, and on the lower, definitely some more back here. Okay, so we like to see this indication of the paper all along, all the way to the mesial of the 4s, but we're not there yet. Avoid reduction of centric holding cusps as much as you can. And once again, I'm going to wipe this down, wipe it clean and dry, and bring my articulator together. It's starting to come together a little bit better. I can see a little more of incisal overlap, a little more overbite happening, but there's still definitely an open bite there. Looking at the pin, still not touching the incisal table yet, so we got some ways to go. Just to show you a bit of a side view because the camera is not ideal. So you'd like to do this while the articulator is on your bench. Just wanted to show you what's happening as I'm tapping away. So once again, I'm going to reduce the central fossa, marginal ridges, inclined planes, and this is where you start appreciating a good investing procedure. I think we could have eliminated some of this posterior premature contact. That's very typical by having the back portion or posterior portion of the flasks a little more centered towards the hydraulic press upon final packing. I'll wipe that off. So this isn't something you want to rush. You want to take your time. Otherwise, you're going to overgrind something, and then once you grind it, it just can't put it back. So turn it the other way. And the sound the teeth are making, that when they come together, it's not a very loud sound right now. It's a very muffled sound, which means I need to create more contacts. And you can see that I'm getting a little further anteriorly now with my contacts. I'm starting to start reducing the fives as well. And you don't want to overgrind one side. You want to do a little bit on both sides. And because of the angle that the teeth come together, you got to remember as you move towards the fives and the fours, you're going to have to do a little more reduction. So it's about a third reduction back here in compared to all the way to the mesial of the fours. So for every millimeter that I'm reducing here, I have to think of reducing 3 over here. Or for every millimeter here, I have to reduce 0.3 back here, or 0.33. Okay, bring things back together and just get a visual. The pin is starting to come together a little bit closer, so that's good. I'm getting a little more of incisal overlap, so that's good too. And we're going to continue. So I'm going to move into a new piece of paper, the other half that I cut off. Loosen these up just enough. And you can clearly see the heavy contact back here, so I'm going to reduce that. Start with what's obvious. A bit of an inclined plane there and here. You can certainly follow the sequence from first quadrant all the way to the fourth in case you miss something. And we'll wipe that off with some separator, with some wax remover, I should say. Wipe it dry and bring things together. It's starting to look better. Not there yet, but it's starting to look better, so we're going to continue with that. If you force the articulator will flex somewhat, and you're not going to get a nice, an accurate imprint of the paper. So you just want a light tapping. It's going to take you a little longer to go through it, but I think it's worth it. And now we can start to see more contacts with the 5s and the 4s. Not so much on this side, but primarily on this side. And over here too with the opposing side. So let's continue with that. Again, my centric holding cusps, which are the lingual of the uppers and the buccal of the lowers, I try to preserve those as much as possible. I haven't reduced them yet, and hopefully I won't have to. And we'll wipe that down. See how we're coming together. Definitely a lot closer between the 4s now. Not there yet, but my pen is almost touching the table now. Almost, it's not there yet. So how open is it? Well, if our starting position was at 0, granted we did lose 0.5 millimeter of vertical dimension of occlusion during our setup and wax up, right? And that's okay, because typically you're going to have an opening in the VDO after processing. So it kind of works to your favor to lose a little bit of VDO during your setup and your wax up. But initially, according to initial measurements, we wanted this pin to be at 0 because presumably that's what we picked for a freeway space of 3 millimeters. So if I were to stop there, and I'm going to loosen my pin and pull it all the way down until it touches, that pin right now is open 0.3 millimeters, which is not a great deal, but instead of having a 3 millimeter freeway space right now, we'd be looking at less than that. 0.3, so we'd be looking at 2.7 millimeters of freeway space because we've opened up the vertical dimension of occlusion. So I'm going to put my pin back at 0. I'm going to remove my pin just to show you something. And I'm going to take the sheets in between the articulating paper, this one here. Now this one here is a lot less than 80 microns. If I could gauge it just from holding it, if this is 80 microns, this feels almost like half of the thickness. So this is probably 40 microns. So, and once again, I'm going to cut it like I did before. And I'm going to place this paper in between. Let the weight of the articulator come down and pull it. And it's catching right here. So that means I have contact between upper and lower occlusal surfaces. I'm going to move it between the 6s. And that's catching, but not as much. I'm trying to use the same force to pull the paper out. And now between the 5s and the 4s, And this comes out much easier because I don't have the amount of contact between the 4s as I do between the 6s and the 7s. Okay? So I need to tap it in some more until I have the same amount of resistance, removing the paper all along the posteriors. So if we look at the other side now, so I'm just gently holding this together, not a lot of force, basically just the weight of the upper member of the articulator that's coming down. And this one now comes out a little bit easier, which tells me that the initial contact is over here somewhere. So this is the area that I need to concentrate. So you gotta, I think if you use this, it gives you a better indication where you need to spot grind or do selective grinding, because the paper itself is so thick it could mislead you. Okay, so we're not wasting paper. I'm gonna use this one now, and I'll cut it in half. And again, I find this to be a little bit on the wide side, so I'm gonna section that off and work in little sections again. Put my pin back on and keep working away. I'm going to do it throughout the arch, but primarily I'm going to concentrate between this area here, the second quadrant molars and the third quadrant molars. If I really hit it hard, I will flex the articulator and the pin will sound like it's touching, but you don't want to do that. You can almost hear it now that it's starting to touch, but that's because I'm just flexing the articulator of the amount of pressure that I'm putting on. And once again, here it is. Here's our initial heavy contact. We need to reduce that. So I'm going to go a little bit heavier with a reduction here, as well as here. And move on to the other side. Even though I do get some indication here, I'm not going to apply a lot of pressure here, because according to this, I didn't have a significant amount of contact. Okay. Wipe everything down. See how everything comes together? The pin is really close now. And continue. And I can hear my pin starting to touch. Reduce the central fossa, inclined planes, marginal ridges, and avoid reducing centric holding cusps. Wipe everything down. And see how things come together. Definitely feel a lot more positive contact coming together now. Less space between upper and lower bicuspids. And the pin, maybe just a hair open. So we're gonna do one more run at it, and let's see how this looks. You can definitely hear the pin touching now. And again, it's this premature contact between second and third quadrant molars that is causing all the interference. Getting a little bit of a contact here on the distal marginal ridge of 1/4, very lightly. Okay, we'll wipe that down. Now things are getting kind of dirty here, so what you can do also, just to clean things up after a certain amount of applications, I like to use a little bit of alcohol fluid from my alcohol torch and just wipe everything nice and clean. And you can see the difference between here and here. I'll wipe it off clean so we don't get confused between applications. Okay, bring things back together. Definitely the pin is touching now. So I've restored my vertical dimension of occlusion as we had it at the maxillomandibular stage as well as the trine, or at least the last trine, depending on the number of trines that you did. So my pin is touching but the question is, are all the posterior teeth touching right now? I'm not sure. It looks like they are. It looks like they are. Definitely they're a lot better when I first started. I do have that incisal overlap or overbite, anterior overbite that we had before. But I think the true test is going back to this little thin piece of paper. So if I bring this together now between the 7s on each side, tentatively just kind of hold the articulator, pinch the articulator together and pull. There is a resistance of the paper, so that's good. How about this side? A lot more on this side. So this tells me that I have a heavier contact on the left side than I do on the right. I'll move forward to the 6s. Very good. So I'm trying to pull it. I'm just basically pinching it together, trying to bring the paper out or slide the paper out. It won't allow me because there's a nice heavy contact there. How about now between the 5s and the 4s? You can certainly cut the paper narrow than that, a little more narrow than that. And that's good too, although it needs a little more work because I can slide it out a little bit. How about this side between the 6s? Just gently pinch it together. Definitely there's a heavier contact on the left side than there is on the right. Not by much. We're talking tenths of a millimeter, if that. Over here, I can pull this out a lot easier than I can anywhere along the left side. This is a little more wedged in there. So if I wanted to create a nice intercuspation on this side as I have on this side, I have to consider my incisal pin now, because the pin now is in the way. How much do I want to reduce? How much more do I want to reduce? Well, you want to do it in increments. You don't want to take the pin out and start tapping some more until you get that definite contact. What you want to do is put your pin back in and overclose your pin a little bit, and I mean a little bit, by 1/3 of a millimeter. You want to do it in increments of 1/3 of a millimeter. I don't hear the pin touching anymore. Just the teeth now. So if the case was, if I were to further equilibrate this case by 1/3 of a millimeter so I can have the same amount of contact throughout the posteriors, that means I overclose my vertical dimension of occlusion by another 1/3 of a millimeter. So instead of having 3 millimeters as we initially decided on this case, of freeway space, now we would have 3.3 millimeters, which is quite acceptable. It's still within the range, normal range of 2 to 4 millimeters. Okay? The question becomes, where do we stop the insanity? Where do we stop equilibrating this case? Because after a while, we're going to lose a lot of anatomy on the teeth. I think I still have a pretty good anatomy here that I can keep going with it. But where does a 20-degree tooth start turning into a 10-degree tooth or a 0-degree tooth? Okay, there's a fine line between having a bit of a discrepancy in your bite or having a gross discrepancy where you have to reduce so much of the tooth surface. It defeats the whole purpose of selecting a certain cuspal inclination for the case. So I'm going to further continue to equilibrate this case by by a third of a millimeter. So I'm just going to use some fresh paper here again. And I'll cut it maybe a little more narrower this time around. So a bit of a thinner strip here. In fact, I'll go a little bit less than that, just to zone in a little bit closer to where those premature contacts are. Very thin. In comparison to that, much, much thinner. Okay, so let's continue. I've overclosed my pin by a third of a millimeter. And let's see how this will work out this time. Try to apply the same amount of force as you're moving your paper, just to give you an idea, as you're moving your paper back and forth between the 4s and the 7s. It's just it's hard to see it with a camera angle. And here again, here's where we have our premature contact. Right there on the mesial central fossa of 3-7. A little bit on the central fossa. Central of the 6. Not so much here. Mesial marginal ridge of 4-5. Just a little bit. And now we're moved to the opposing. Distal marginal ridge of the 6, a little bit of the inclined plane here. Trying to round things off, don't just spot grind. Like when you grind, just maybe just round things around a little bit. Round off things around the area that you've reduced. Mesial marginal ridge of the 7, distal marginal ridge of the 6, mesial marginal ridge of the 6. And here, I'm going to leave that alone because I reduced it here. So there's no point of reducing it again. Pin is not touching. I don't hear it touching, just by lightly tapping it together. So I'm going to continue some more. And when you get really close to having a very good intercuspation in centric occlusion, you don't want to be tapping very hard. Just basically let the weight of the articulator come together. And once again, we have premature contact primarily between the 2nd and 3rd quadrant. But definitely we're getting some more contact between the 4s and the 5s now. Not a lot, so I'm not going to go very heavy, because once I trim it off, I can't put it back on. So if you're not sure, just go lightly. And we'll wipe that off. And this is a little bit of alcohol. And let's bring that together. Pin is starting to come together only when I hit it really hard. If I don't hit it hard, it's almost touching together. But before we go any further, let's check it with our little paper here. Just tentatively hold it together, again creating the same force and trying to pull it. It's coming together a little bit better. How is it here now? Still, it's pulling away. This side, I anticipate to have much, much tighter contact, for sure. Can't pull it out. Better. So this side is in tighter contact between the bicuspids than we have on the right side. So I'm going to continue a little bit more. Still have a little more forgiveness in terms of the pin. I'm still not overclose another 1/3 of a millimeter. Even if I had to overclose 1/2 millimeter would be acceptable. And a little bit here. I anticipate my pin to touch now. Very close to it. So let's double check again with our paper, or our separating sheet, I should say. Still not there yet. I can pull that out. It's within reason, it's acceptable, but that's even now. I think I'm getting the same amount of force or resistance now between the bicuspids on the right side as I'm pulling the paper through and as I do over here. Same amount. How about back here? Definitely getting more resistance. It's also due to the fact that these teeth are wider than the bicuspid, so they're going to grab the paper a whole lot more. So that's good. And what about this side? That's pretty good too. If I'm not satisfied with this, and if I think I'm not going to remove a lot of the anatomy off the teeth, I can further close my pin to 1/2 millimeter. So I went from 0.3 millimeters of overclosure to 0.5. So instead of having 3 millimeters of freeway space, now I'm going to incorporate 3.5 millimeters of freeway space, which is still within the acceptable range of 2 to 4. Okay? So I'm going to continue a little bit more. I'm going to take this little piece of paper and I'll cut it even thinner. And tap again. And just move it up along the posterior teeth here, back and forth, and see what we have. So we have a little premature contact here. Definitely this side now looks heavier than that side, as we have on our 3rd quadrant. So without creating a great reducing a great amount in the central fossa. Let's see if we can get this side to have less of a premature contact and to have this side come together. Although this is starting to look so much better now, but very lightly. one back here on the distal marginal ridge of 4-7. So this takes a little bit of time. And you want to take your time doing this because any occlusal disharmonies in centric occlusion and or lateral excursions will create a lot of sore spots and a lot of discomfort for the patient, because all those occlusal disharmonies will be transferred to the underlying bone and tissue. The dentures will have a tendency to be very unstable, and they'll cause a lot of discomfort to the patient. So if I were to open the pin now and hold my case together and bring my pin until it touches, I've overclosed my case. Just do that again. 1/3 of a millimeter, which is not a lot. Okay? Which is not a lot. So if I take this out, just to give it a final look, now we have the incisal overlap that we originally had at the last try-in stage. It looks like we have a nice tight contact between upper and lower posteriors. I have the same amount of overjet that we had before. I'll take this out just to get a better view. And the same on this side. Furthermore, if you remove the case off the articulator, just put this back together. So I'm going to remove the mountings as well as the dentures off the articulator. And if you tentatively hold things together, just by hand articulating it together, you should have a very positive sense of centric. Right now I'm trying to rock the case. Got to be careful it doesn't slip out of your hands. I'm trying to rock the case, twist it, trying to rock it interior, posteriorly, left, right. It looks and it feels very solid to me right now. My midlines are lining up. I have this nice vertical overlap of interior teeth, and I also have horizontal interior overlap of interior teeth. And of course we have a nice buccal overjet that we had before. So at this point, this looks very good to move on to the next stage, and the next stage would be to equilibrate the case in lateral excursions. And you'll see that on the next video. But just to give you a bit of a heads up, for lateral excursions, we can remove the pin. We don't really need it. Undo one of the centric latches, and you want to do it one at a time. And we're going to move the case into a lateral excursion one way or another. It really doesn't matter which way you start. So if I were to shift this over, you can clearly see that I don't have any incisal contact between upper and lower centrals. And I'm not sure if it's clear on camera. I don't have any balancing contact on the left side. So therefore, there's got to be a premature contact somewhere on the right side, on the working side. Lock that, open the other side. Let's see how this looks. This one looks even worse, actually. Even more of an open, a bigger open contact here. And visually, I'm assessing that it's prematurely touching with the 6s and the 7s. And the balancing is not there. Let's check the protrusive. Protrusive looks pretty good. So I have less work to do with the protrusive. So we got a little bit more work to do in terms of equilibrating this case to have balanced occlusion. We did it in centric. Now we have to do it in working in balancing and protrusive. And that'll be on the next video.